So right now it's still at about a 3, but usually it takes it down a little bit.
Okay. So it's down to a 3? What was it earlier? Or you
No, it is about a 3.
Okay.
I'm hoping it'll go down a little bit further than that.
Okay. Well, I'm gonna get your blood pressure real fast.
Is there a rolly chair? Why would I suggest that right now? It's hovering. He hasn't really told me that he was putting on the blood pressure
I just
cuff.
started doing it.
You just started doing it.
Is it okay?
Yes.
Oh, it's okay. Okay.
And this also helps his body mechanics, right?
Yeah. Now I feel better.
And now your eye, you can look at her.
Okay, so we got blood pressure taken before?
Yes.
Okay.
I'm a
So
nurse.
you
We have
are.
it all the time.
Of course.
Leo, you want to
Alright, so you know what to expect here. So I'm gonna do what you do every day.
That would be helpful.
Hold on.
Some homemade physical agents.
Ready, set, go.
Honey, use that towel.
Another thing that happens a lot is accidentally leaving, not leaving it open. And that always throws people for a loop.
Oh. Thumb on the.
Yeah. 122.
They said Miss O would be upset. Why?
Because I didn't ask what it was before.
No, your thumb is on the.
Well, that too, Devin.
Oh, I can't put my thumb.
No.
You hear your own heartbeat from your.
On the backside?
Yes.
Mm-hmm.
It's a diaphragm.
It was kind of hard to hear anyway, but that makes a lot of sense because there's no thing in here.
So, what did you think you got?
122 over 83.
Okay.
I could hear it a little
Yeah,
bit, but it
that's-
was really hard.
That's very typical for me. I usually run 115 to, and okay, who's ever number 6? Who's number 6 on Monday? Yeah, you're gonna have a really hard time finding my blood pressure at that point. Okay, just know that that's just one of those that it just whatever.
Just know it's
Can I just do, can I do the other arm and just be like, I would normally do it on the left side, but
Yeah. Well, you can use the right
I'm
arm.
gonna drop the tape for that.
There's no reason why not to. Did it say there wasn't?
You get a better
Miss O
pressure
just
in
says
the left.
always use
You
the
do.
left side because it's closer to the heart.
Yeah.
It does
But there's
the
no
best.
reason why we couldn't. Yeah.
There's reasons why you can't use a left arm too, and we'll talk about that next year. Fistulas are different things. Fistulas and.
Okay, now I get your heart rate. Sorry. Something like that?
How long would you take it?
Full minute.
All right, and let's say you got 58.
15 seconds.
Did it really? Are you at 80?
Yeah.
That's off. I haven't worked out in a while.
I got 80 there, and I keep good respiratory rate too. So I just count all that. So I'm gonna act like I'm taking it again, but really I'm good at everything.
All right, so let's say they're 15.
Okay, 15.
All right.
We're within normal, right?
So what do you tell the patient about all that stuff?
Okay, so it looks like all your vital signs are very good. Which is, what is your normal one? Because you're normally at, well, your thing said
144 over 84.
Okay, so 144. So because you're a different person, you're good now.
Maybe it was white coat syndrome that I had it. But at that point, when you get mine
must
that
be
says
relaxing.
120, whatever, she's gonna say, you know what, really, they were 140 over 82. Okay? And that's what you'll write down.
It's taken us 6 minutes to this point.
Even with all the stopping and pausing.
Kind
So
of
you
more
got
time.
24 minutes left.
Okay.
Yeah.
Okay, so you said it was still swelling. Why do you think it's swelling? You up on your feet a lot because you were working, is what you were saying?
Yeah, I worked a 12-hour shift yesterday. I was up, I mean, I sat as much as I could at the computer desk, but
Okay.
no.
Okay, but you still feet are down, not really relaxing too much. No, you don't know how to relax being a mom.
And the nursing.
Oh yeah, and you walk all day too.
Yeah.
Well, kind of try to find a way to get off your feet for a little bit, give a little bit of a break. Help with your swelling a little bit.
Okay.
And then what?
Maybe paperwork. Sit to do paperwork.
Well, and that's why I told him I did the
Oh.
computer by sitting. But during that time, like you said, I'm still getting that blood flow, so I could even have them propped up or something like that to kind of help with it.
Yes. Okay, so now we got that. Still going?
Tag team.
So I'll do the whole thing if I need to.
No, come on.
Dang it, I gave you eye contact. I didn't look away.
That's where you went wrong, Mel. We're used to you looking away.
You never know.
Here, I'll just leave those. I can just leave these here.
Are all the above questions?
Yeah, I just.
Okay, so just keep going. So my vitals look good. You just educated me on taking more opportunity to rest.
I did that really my head. Okay.
You're done.
Yeah. Maybe. So now we said that we were gonna work on your foot that's flat. So what I'm gonna do is.
I keep saying that.
Yeah,
My
that's-
foot that's
It's
flat.
not like I'm saying your
Offensive.
foot's flat.
What's wrong with your foot?
So you had the procedure, which affects you whenever you're walking, when you're walking like this. So what we're gonna do is we're gonna you called on me, I wasn't ready, I didn't have my shoes on. So we're gonna do some wrong exercises.
Don't say
Which,
wrong.
Sorry, we're gonna do some range of motion, and it's gonna help you kind of lift your toe up a little bit more. That way you're not walking kind of with the flat foot. I don't know what else to say that's not flat foot.
We want to make sure that you're getting that good toe off. So right now, you're not really able to push off with that toe, and
foot
that's
clearance.
because you don't have the range of motion that we want you to have. So we're gonna work towards that.
Okay.
Or foot clearance.
Yes. So, to do that, we're going to use an ultrasound to heat up the tissues first,
Oh, okay.
and then I will actually have you with your leg propped up here, and then I'm gonna put the ultrasound on, and then a few minutes in, we'll kind of move it in that position when you're long sitting.
So in order to do an ultrasound, what do you need to make sure that you verbalize, that we have to hear?
We get the towel.
That.
Before you turn the machine on.
Oh, are you wearing any monitors? Are you pregnant?
No.
All your bones are grown, so.
Yes.
Patients don't understand that.
We're reading down.
You would,
So listen, this is when you go through the contraindications. Hey, I need to make sure a couple of questions before we start.
Are you wearing metal?
Am I
Are
wearing?
you wearing metal or devices?
she has jewelry on.
I do have some jewelry on.
That should be okay up here though, right? Yeah. Alright, so that should be fine. Do you see any contrast?
So she's got metal in her foot, right? She has a fusion.
Is it metal still?
It's not
Fusion.
a contraindication though, is it? It's
Right, because you're not going to that area, but you would want to know that she has metal, she has screws in her foot.
So that's okay that you have the metal behind your foot. We're gonna actually be.
I can hear
within
talking.
The top of your foot, okay? So,
You're gonna do that? I'm sorry.
I said it's okay that you have the metal in the back of your foot, the ankle. Oh, I'm sorry, it's the other way around. We're not gonna be working on that side, we're gonna be working on the other side, so it's okay.
Okay.
So now I'm gonna.
She said, we're gonna do this.
So for ultrasound, let me have you seated first.
Do we have the extension cord? It's where?
Keep going, Mel.
So for ultrasound, we're trying to do what kind of.
Need some tech help.
So I am gonna be doing on the dorsal.
Well, if we're promoting dorsiflexion, where do we want to heat up the area?
What,
Absolutely. Okay, so what she just asked me, she said, if we're trying to work on dorsiflexion, what would be the front side? And I said, no, we're actually think about it. What we're trying to achieve is the length of the plantar flexors, right? That's that muscle length. So then she said, okay, so I need to have you in prone. And then she went, with a question mark. And I said, yes, that sounds like a good idea. So she's processing through that right now.
Because I'm trying to think of like the position of when I'm gonna have you do the stretching after.
Okay.
But
Can you do a stretch while you do that?
So we've never done that
That's what
in
I'm
class,
thinking.
so.
That's what we're doing now.
Okay, cause I'm like,
So what I
I just need to
choose.
see this.
Is
So
it
it's a-
mostly positional stretching? I mean, you can
So,
have them do it
come right
after,
here.
but it's,
Lay on
you know, you can position.
From? I want your foot down here.
From,
Okay. Well, scooch it down. There you go.
yes.
All right, so we're in this area. Come on, scooch down just a little bit more. Beautiful. All right, so I'm gonna use my knee right here to kind of help, and we're gonna.
I thought you were like meaning you're doing it and then you're pushing.
Yeah, so I'm
Or
gonna.
you're just letting her leg rest on his leg.
Because it is
Using my knee,
But
to push
she's
into it.
getting flexion here.
Yeah, so I would have to actually put something right up underneath it here. I was just trying to give them a general idea.
But then you're black and white.
Yes. Okay.
Yes.
So y'all see that?
I
And
know
we could do it there?
I know when we talked about it, our minds immediately went to active stretching
Yeah,
with
that's
the
what I was-
ultrasound instead of like positional stretching.
No, yeah,
That's-
no, I can,
Yeah.
I'm heating. So think about when I heat an area, then I can passively take them through that, right? To gain that range of motion. So I'm heating the area, I'm using continuous. On a piriformis that's spastic,
Half of y'all missed it.
Today.
piriformis
Spastic.
that's in spasticity, do I heat it?
No.
Or, yes, I do.
You do?
Why wouldn't I?
I thought the specialist that you use cold.
No.
To decrease
Spasticity-
spasticity.
Relaxation. Cold.
If I'm trying to relax the muscle, I'm gonna heat it, so I'm gonna use continuous.
You can use prolonged cold. Is what you
20 minutes, but most of my ultrasound treatments are 8 minutes, so we're gonna use continuous to help with spasticity. Cause I teach a lot of spasticity in neuro, and we use a lot of heat and warmth. Cold is gonna make you spastic more.
But what
If
did
I
y'all
do
learn?
heat, then it's gonna relax a little bit more. Piriformis, I'm gonna do continuous if it's spastic, or if I'm in muscle spasms.
I think we're confused because of the MS patient where they had the vest with the ice packs in it.
Why?
It was
Because
too cold to.
y'all didn't know this because you haven't had management of neuro yet,
Mhm.
but with a patient with MS, then they don't do well with heat. It actually exasperates their symptoms. So we would always use cold with MS. That's totally different than any other patient with spasticity.
Workout in cooler times of the day. Fans.
Okay, so Mel's gonna take me here, and Mel was a little bit propped into anterior pelvic tilt. I don't want that. I want this pillow up underneath, right? We're gonna keep them in good posture, right? Okay.
What time do you have to go?
She canceled. We're gonna see her next week. At 2.
I don't even know. I gotta
Two.
get my phone.
What time is it?
142.
We both have one at 2. I just get my phone. Okay. So we could do ultrasound, right? Just make sure they're positioned well for this. Like she said, put the towel roll underneath of there. You're gonna do a little bit of a stretch. Do the pillow of gel on my Achilles area. Go ahead and turn it on. We're gonna ask you what the parameters are that you're using.
You know how like before skills checks y'all give us like the you know how you give us the diagnoses? Are you gonna do that for us? You said that there's 6, but will we know?
Oh, I'll tell them to you in just a second. We're gonna go through this real fast.
And you said that there is, like, you've narrowed it down and you're gonna do.
I'm gonna do that to you, gift it to you in just a second. So what are the parameters she's gonna use on the Achilles?
So I'm gonna do
3 megahertz.
Why 3?
Because
Because
it's
it's
superficial.
Okay.
so 3.
Well, this is superficial.
We're gonna
So
do,
we know we better.
we're gonna do 3 megahertz 100% continuous because we want heat because we want to loosen up.
Okay.
And so I'm actually gonna take measurements first to see what we have before we get started, and I'll take it after.
Okay.
So I'm gonna take. Alright, do you want me to actually do it? Or?
Well, y'all need to know how to do your range of motion, right?
Yes.
I think we're, Dr. Ruski and I are in a bit of a little bit more, we gotta get out of here, so no, I'm not gonna make you do it. But know exactly, she's gonna say, where are you lining up? Where's your,
Fulcrum's gonna be on the lateral and then proximal on your.
she's gonna ask what those measurements are, she's gonna walk over, she's gonna take a look at it, make sure it looks right, and she's gonna say, okay, there's 0 degrees, or there's 4 degrees, wherever you're at, okay? Then you start your treatment, your ultrasound, you've got me positioned well, right? Think about when, I'm just throwing this out there, with patients with low back, please remember all your precautions on if this would be good, right? Extension biases and flexion biases and things like that, okay? Okay, moving on. I think we're seriously in a hurry, so I'm just gonna keep moving on. So then you would take me, you've already stretched me, you've already done ultrasound, right? Then maybe you have me do another exercise, just flip it over, do the other exercise that you want me to do, or the isometrics, whatever we chose to do then, right? All right, I think we're done for today. Let's take another look at that range of motion. You did the range of motion there, all while I was right
You
there.
have an increased range of motion on your toes. I mean, your feet, your ankle. So now, now we're able to probably lift the toes up a little higher and help with your
And then she gives me that good take-home message. Oh my gosh, you improved by 3 degrees today. We're going to keep doing this, and I need you to remember that you've got to continue with that home exercise program that the PT gave you 2 days ago. What were those? Well, make me say them out loud, whatever they were. Okay? All right, I'm going to see you in 2 days. Close it out. Go document. Okay? Does that help you just to see it like that?
Yes.
Okay. All right, so let's talk about it. I have this written down for you. I guess I haven't done it. So these are the possibilities. I'll post them, but so you can have an idea for today. Possibilities are cervical, herniated nucleus pulposus, a disc, herniated disc action.
cervical herniated.
Disc. Possibilities, cervical, HMP, shoulder, total shoulder, and rotator cuff, tear. No elbow, no hand. Hip, THA, knee, TK, and ACL, lumbar, laminectomy, and fusion. You've had this, right? You've had all these at some point. Skills checks.
Those are the possible.
These are the possibles.
There's only 5?
Huh?
There's only 5? Because they're ankles.
1, 2, 3, 4, 5, 6, 7, 8.
Oh.
Possibilities.
Oh, so it'll be like total shoulder or rotator cuff, not.
I thought it was like
Right.
5 for each.
Yeah, no. So it's either you'll have a shoulder that's a total shoulder, or you'll have a shoulder
Rotator cuff, and the same with the
that's
knee.
a rotator cuff.
Okay.
But you need to study all these.
You said no ankle and no arm.
No wrist, no foot, no ankle, no elbow.
Thank you.
Thank you.
Thank you.
You're welcome. No TMJ.
I'm gonna get up there.
I canceled all of that today. Is that what it is? Do you have the only 2 o'clock? Yeah. And she just asked me what time. Tell her 2:15. Tell her 2:15. Okay? Does that help you?
Yes.
This is my suggestion to you. I know you are tired. If you need to go outside and walk, but I would utilize today data collection toolbox. You need to go through that ankle scenario in its entirety. Practice vitals, practice getting those machines back out, right? Practice what you would do with each one of these scenarios. What might I do with the total shoulder? What might I do with the rotator cuff physical agent wise? Okay, give yourself a focus point today. Okay, don't try to do too many things. Just give yourself a focus point. Finish toolbox, everybody except for Sydney, and then figure out if you're going to study for TheraX and or what focus your area going to be here. Maybe it's the TheraX portion of this that you're studying for. Okay, except that we don't really have joints. You forgot about it, didn't you? No, they forgot about the test tomorrow.
I think we all had that, but he just.
He expressed it. Yeah. Okay. Then tomorrow you have the test from 8 to 10, but guess what? You have the rest of the day to stay up here and practice. Okay? And toolbox. Guess what? You get to stay up here and practice. That's so exciting. Then Friday they don't really have a lot of time to practice until we're done with Texas Women's, which is right around 2. So you can come up here from 3 till 5:15. and before you go to
Well,
Corsicana.
We have to be at Corsicana at 6, right?
5:15. Well,
45 minutes
6:15. I'll let you be there by 6:15.
Okay.
It's about more like an
Oh,
hour.
what do we
What do you
wear?
wear?
Oh,
Yeah, Friday, what do we wear to the graduation and
Regalia.
and the TWU?
And it's, yeah.
Don't get me started. I was not a very nice person on Tuesday. Yesterday.
Please do tell.
No, I may not be here next semester. Let's just say
Did
that.
not like that color of gowns, by the way.
We're not doing
Do you like
any
her
kind
no?
of regalia. No, for real. Y'all need to dress. Oh man, that's a lot of things to do in one day.
Professionally.
Just yeah, you know what?
Like
If
when
you
y'all
just
get
want
up
to
and do
wear
your little.
like your polo,
Can we wear jeans or no jeans?
not to graduation.
Like slacks.
Well,
Like,
that's
this is-
what I-
like,
I
this is
hate the
casual.
polo.
This is
can't wear
casual.
those.
But I don't wear polos either. But I mean,
They
wear
don't
a
wear
nice
just
blouse. Wear a nice blouse
This
and
is- this is
Yes.
Those polos are
You
not
know,
flat.
So,
I've seen a
dress
polo
cute?
that-
no, I agree with
I can do that.
It's a box.
right here. So listen, if just wear that to graduation as well, because the focus is going to be on the other people. So
I prefer
Let's do the
wearing
shirt.
regalia because I'm getting my kids.
But like slacks or something.
You messed that up.
huh? If you want to wear a dress all day, or you can bring it to change into whatever you want.
to wear to the thing, to the
That's